Hello there, my friends. Welcome to Carpo's channel. I'm going to talk about health insurance here. It's probably one of the most boring subjects, but the issue I'm discussing is the outrageous price of health insurance, as well as the guilt that is put upon people who don't have it. Now, I'd like to say, first off, as a father and a family man, I have 3 children, one who's 6, one that's 9, and one that's 24. I've been with my wife for 20 years now, and our oldest son, I got together with her when he was 3 years old, and during that time, we were lucky. He was a healthy boy, and we didn't have any major issues, besides the basic dental work and a couple of doctor's visits for this or that. We got lucky, and in that time, I as well got lucky. I didn't have any major illnesses or problems, and we moved into our house here about 15 years ago, and about 10 years ago we had our 10-year-old son, 9-year-old, and a few years later our other son. And over the past several years, I've gone back and forth on the issue of health insurance, and whether or not it's worth it to even have health insurance, considering the overhead and cost. And so I wanted to discuss this as far as the costs of health insurance. This kind of blew my mind. This has changed drastically, the price for a family of just 4 for health insurance over the past, couple decades. From what I just looked up the numbers, for a family of 4, the average cost of yearly health insurance total is $28,166 per month, or per year. Now that's $28,000 per year for a family of 4. Now this is the employer based healthcare cost. So generally, like 2/3 to 3/4 would be paid by the employer, and a chunk out of the employee's check helps to pay for that. Honestly, I'm not sure how it works because I've never been fortunate enough to work for an employer that offered health insurance. My wife has been working for the company she works for close to 20 years now, and they don't offer health insurance. So both of us have been in the circumstances where we don't have employers that offer it, and the cost for us to get it, when I looked it up last time to figure out the bare minimum cost for us, as just the 4 of us, because my oldest son, could get his own insurance. The lowest cost I found was like $600 or $700 per month, and that's with very high deductibles. And it's just ridiculous. So I'm going back and I'm adding up. Let's average it out. Let's say that in a year it costs me $10,000 to have health insurance. And I've been with my wife for 20 years. I mean, you can do the math on this. We would have spent between $100,000 and $200,000 on health insurance at the bare minimum. And what would we have to show for it? None of us have ever got sick. Now, let me just back up a minute, because that's not an excuse to not have insurance. People do get sick, and some people have a surprise that pops up, and all of a sudden you have no insurance and you need the help. This happened with us when my wife was pregnant, and we had a surprise that the placenta was over the birth canal, and we had to have a C-section. We panicked, because our intention was to have a home birth and to do it our own way. And now we have to depend on the hospital and the staff to do this. We panicked, but somebody came in and helped us out. We filled out the paperwork. We did qualify, and we were able to get the state to pay for it, which I had mixed feelings about that. I thought, this is my responsibility, but at the same time, I do pay taxes into this society, so shouldn't we have some sort of a, at least a slight benefit or, assistance for this? And I'm torn on the idea of how much a society should pay for the people. I also realize a lot of the people who take care of themselves and are well also have to pay these premiums for people who don't take care of themselves, who get themselves into severe addictions or harm themselves physically or mentally or otherwise, and then the system they end up being a burden on the system. And I hate to say that, because these are people, but what I'm saying is, overall, this is the mentality some people have, is why should I pay for someone else's health care? But I'm in the camp where I firmly believe that taking care of a whole society is better for everyone, because if anyone's suffering, then we're all suffering. Now here's the issue. It's not about who gets health care, or it's really about how much money is being diverted for other funds. One of the biggest issues with health insurance itself is you're paying thousands of dollars per year, and it doesn't even cover basic preventative care or routine maintenance or certain tests that you need to have done. Hell, it doesn't even, you still have to have a copay on your medication. On top of this, they will deny claims. So you pay into insurance for years, and then you finally have an issue that you need to get taken care of, and they deny it. They find a way to fight it. Anybody who's had car insurance and gotten in an accident knows how this works. They will do anything they can to get out of paying for it. So they will also change coverage, where they have permission to change, the parameters of the coverage at any time. And sure, they have to notify you, but they can throw it in this very confusing mess of words that nobody really understands, obscured purposefully. And one thing that is never mentioned is that there are about 22%, from what I found, the number is 22% of fees that just are hidden fees that just pop up, whether it be hospital fees or conversion fees to use a different provider or whatever it might be. It's all about the money. And for an industry that, that charges so much, they're in the multi-billion-dollar profits. So it's really hard to say, well, there's just not enough money to go around. It's really not about the money, it's about the greed. If you go into a hospital and they're charging you $50 for a fucking Band-Aid, then you know something's wrong. And that happens. Even a basic little bandage or something. I mean, the prices that they charge for these things are just ludicrous. And these standards are set by the industries that profit. The out-of-pocket expense for medication, a lot of people don't know this. If you go into, say, a Costco or a Walgreens pharmacy, and you have insurance, and you say, okay, I'd like to buy this heart medication. And they might say, okay, well, it's $500, and your copay is, say, $20 or $50 or your portion, whatever it might be. There was a story of a guy who went in to buy his wife's medication, and he asked, just out of curiosity, how much would it be if I just paid cash? And they informed him that it would be something around $30. It was about 1/10 of the price. If he has insurance, it's 10 times more. And it's 1/10 the price if he pays cash. So needless to say, he paid cash and it was less than his out-of-pocket expense would have been to buy it on the insurance. How can anyone justify that? How can anyone say, well, this is just the way it is? I mean, and in the industry and justify that. There's just no excuse for it. It's greed, and it's part of the problem. Because I, as a citizen, I would like to have health insurance. I would like to know that if something happens to me or my family, then I can be taken care of. But even if I pay $10,000, $15,000 a year, that doesn't ensure coverage. It doesn't even ensure that I'm going to be taken care of if I actually harm myself, or get harmed. I shouldn't say harm myself. That sounds wrong. So yeah, it can cost 10 times more for some of these medications, as well as procedures, depending on the doctor, depending on the insurance company, and depending on what they can get away with. So the U.S. spent $3.4 trillion last year on healthcare, and the average was, I think, $10,345 per person. So look at it, $10,000 per person on average. That tells you something. It says that there are people who are, receiving $1 million treatments, and then there are people who never have any ailment. And the person who says, well, I'm healthy and I take care of myself, why should I have to pay for other people's health care? They have a legitimate complaint. But when they lose their job and fall and get their arms ripped off by the machine or whatever it might be, all of a sudden they're the ones that are in need. It's the same kind of idea when people say, well, I don't believe that we should give money to I don't believe in welfare. And then all of a sudden their business collapses, they become unable to work, and all of a sudden they're using the welfare system. These things are put in place to benefit society. The idea that, theoretically, the idea that having insurance will actually help to have a cushion to back you up in case something happens. But I would have paid $100,000 at least in the last 10 years on insurance. And how much have I used? None. And when I really thought about this, I thought, okay, we've spent a few $1,000s at the doctors and the hospitals with various issues. The most money that we've spent was at the dentist. And health insurance doesn't cover dental. If you want dental, you're going to have to pay extra for dental. And even a lot of people that have dental insurance, it doesn't cover what they might consider cosmetics, which could be simply a crown or something to help you eat. And so I've thought in the past about getting dental insurance and looked into it, and it was ludicrously high. And I thought, but that's understandable, because if you don't take care of your teeth, like I didn't take care of my teeth, then we pay the price. So I went in and had to pay for all these new crowns, and that was my fault. I understand that. And so that money came out of my pocket, and I get that. But no matter how well we take care of ourselves, something might happen. We might have a heart issue. We might end up with a lung issue because of somewhere where we live in an industrial area, and there's nobody nobody to sue, nobody to pay for our health bills. So all of a sudden we need the system to help us. And so there are those who pay high premiums and never use their insurance, and then there are those who are always at the doctor, and who, since they make below a certain threshold of income, all of their health care is paid for. So I guess if there were to be any change to that, I would like to see people, even if they can't afford it, to become a little more, I don't know, it's a difficult issue. That's all I can say. I don't think that, if you can't afford your medication and you can't afford a doctor, then you can't afford it. That's just the way it is. No amount of scraping and taking back bottles and cans is going to help you pay a doctor bill. So sometimes we do need help. But I was just surprised to find that it was almost $30,000 for a family of 4, and that the employers end up eating so much of the cost, and that is pushed back onto the consumer. And the healthcare industry is just chaos. It's just disgusting. And so leave a comment. Let me know what you think, as usual. And what are your feelings about health insurance? Is it worth having? Talk to y'all later. Be well. Carpo's channel, 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 Carpo's channel.